Representative Bentley has appeared. We have a quorum. Thank you, sir. I appreciate you being here greatly. For many of us, I know this has been a long day, and we'll try to get through these presentations as quickly as possible. What I'd ask us to do today, since we're going to have a wealth of information and be quite candid with you, I'm not sure we'll be able to cover it all today. I just want to kind of put that caveat out there, but ask you to hold your questions, kind of collect them during the presentation, then we'll do questions as a follow-up to the presentation. So with that, we'll ask the cabinet officials to come forward. And while our friends from the cabinet are preparing, would ask for a motion on the minutes. They have been distributed. I hope you've had a chance to review them. Is there a motion? Motion and a second. All those in favor say aye.
Aye.
Any opposition? You can tell this is my third meeting of the day, and then it's kind of all starting to run together. So ask y'all back just a second while we do roll call next, and then we'll get this going somewhere or another.
Fine.
I hope. Roll call, please.
Senator Rocky Adams, Senator Alvarado,
Here.
Senator Berg, Representative Bentley,
Here.
Representative Herron,
Here.
Representative Mosier,
Here.
Co-Chair Meredith,
Present.
Co-Chair Meade.
As noted, we do have a quorum with that, and we've already approved the minutes. See, we're getting back on track again, and life is like it's supposed to be. And if you would, please identify yourself for the record, and feel free to proceed.
Chairman Meredith, for the record, I feel you. Eric Friedlander, Secretary of the Cabinet for Health and Family Services.
Marta Miranda Straub, Commissioner for the Department of Community-Based Services.
Good afternoon. Lisa Dennis, Deputy Commissioner for the Department for Community-Based Services.
Thank you for being here. Let me just make one quick note as to why you folks are presenting today. You remember last month we covered the Medicaid, which is the largest part of the cabinet in terms of dollars expended, but this portion of our cabinet is the largest in terms of number of employees. So we thought it was a natural progression to let them present information regarding this. So that's the intro.
Great. Thank you.
You're up. Thank you.
Thank you. I'll begin by introducing a little bit the two folks who are sitting next to me. Commissioner Marta Miranda Straub comes to us. She taught social workers at Eastern Kentucky University. She has a long history of working with women who were victims of domestic violence, long history of working with folks who have been marginalized in communities. And when I went to the city of Louisville, and I know I've talked to you all about this, I was really concerned that we were never able to address within the workforce in DCBS what's referred to as secondary trauma and primary trauma for that matter. And I went right to Marta. And I asked for her help when I was at Community Services in Louisville Metro Government. So I was very excited to be able, one of the reasons I came back was to address that issue. I really felt terrible that we were not able to do anything about it. So I consider Marta to be the foremost expert in the state. Her agreement to come out of retirement, she's given me a new word, rewirement, as she calls it, to lead DCBS. And it's a very different commissioner than has ever been there. I don't think that that's just the way to say that. I've worked with a lot of commissioners. When I came back in, I couldn't think of anyone that I wanted to ask, and so I feel very fortunate to have been able to attract Marta, who then saw us, the governor and I and Steve Stack, on the press conferences, and felt like she needed to come back and help, which I appreciate greatly. Lisa Dennis, Deputy Commissioner, has worked in the department for many years. She's worked her way up through the organization from frontline worker to now Deputy Commissioner. her wealth of experience, her steady hand, it's almost, I'll use another kind of little sports metaphor, right? But it's like lightning, thunder and lightning, right? In terms of, Marta's a change agent. Lisa is the type of person that can implement change and has the history of the organization and history of the front line. So I really like the pairing. Of course, I am biased, but I feel very fortunate to have them as part of the team. Of course, tremendous challenges, and we'll go through those. All sorts of challenges with COVID and getting benefits out the door and all sorts of things that we talked about a little bit earlier this morning, but having to shift on a dime, changing the way that we do things very, very, very quickly, and the ability to be able to do that, I can't say enough about their leadership, and also then the folks who work for DCBS. We talked this morning about public health, and we talked about, it's the same folks who are, working on floods and tornadoes and COVID and ice storms and avian flu and what else did we say? There was something else. I always mention frogs and locusts, which you liked. But all of those things, right? And it's the same people. It's the same people in DCBS as well. So I couldn't be any more moved by the work that folks have dedicated their lives to. So with that, Marta, I will turn it to you.
Sure. Thank you for inviting us to tell you about our agency, and hopefully you got our information in readable terms in regards to how we're set up. I am honored to be here. This is my 48th year as a social servant and failed retirement 1.0, and hopefully we'll be in a better place so I can go retirement 2.0 soon, but really glad to be here, honored to be here working on structural and systemic change and how we address issues with our staff, with our clients, issues of disparity, issues of equity, all kinds of work that we're doing, in addition to doing, what we're called to do by all of you and by the Commonwealth. So honored to be here. Let me give you just a short overview. DCBS is responsible for delivering services to families that enhance self-sufficiency, improve safety and permanency for children and vulnerable adults. A lot of folks don't realize that we also do vulnerable adults. So our job is to engage community partners and collaborate together. We are, we need a big C in DCBS, and that means community partners. That include our qualified residential folks, as well as many other groups. We provide services related to child care, child and adult maltreatment, prevention and protection, child and caregiver support, and public assistance. Services enhanced through a close relationship and coordination, like I said, with community partners. We are one partner with community. We are comprised of 4,000 state employees. We're supposed to have 4,500, but we got hit like everybody else in regards to folks moving and going, and we have begun to shift that needle. But we have 4,000 state employees in every county in the state. 4,065 full-time employees is what we're supposed to have. 112 are interim folks, and then you have the service regions in this map, so that you know that we are divided by regions, and we have 9 regions across the state. If I go too fast and you need more specific, please stop me. If not, I'm going to try to move and then have you ask questions. You should have a chart of the organizational structure, and we're very proud and very grateful. Thank you to have added a division of prevention, and thank you all, especially Senator Meredith and your help, Senator, the help of Senator Meade as well. What we are moving here is into our budget, and we have our budget person in case you need us to get in the weeds. But for that, I'll turn it over to the secretary.
Thank you. And I do want to roll back for just 1 second. You all passed a reorganization bill, and within that reorganization bill, we were able to, it gave us the authority to set up that prevention division. We have talked about prevention, you all know, for years and years and years, probably as long as any of you have been sitting here. And we try to emphasize prevention, but our structure didn't reflect it. And so within DCBS, to be able to set up prevention, to be able to set up a whole division to work on that, and we'll get into more details about Family First prevention later in this presentation. I know structure sometimes I like to say is like where you like to put the couch in the living room, but I think in this case, putting prevention forward is an important, at least, statement for the department to be able to do. On to budget. A lot of DCBS is federal grants. This is unlike Medicaid because most of these grants are like block grants. They're capped. A vast majority of them are. Most of these funds relate to things that you would think of. I'm not going to give you the grant names, but there are specific grant dollars for childcare. There are specific grant dollars for children in care. There are specific grant dollars for particularly children who are at risk for coming in care. So all of those pieces are capped at this point, but we have used some of those, have converted to what's called Family First Prevention. Under the previous administration, Kentucky was one of the first states to have a Family First prevention plan. Thank you, Mr. Clark. And so as we talked this morning, those who were there, we have some places where we're first and leading the country. This continues to be, and was a place where we were leading the country. And very much in the lead on that. So thank you, and we continue to build on that work. Next is, unlike Medicaid, right, where you had this little bitty slice of personnel, DCBS is different. 4,000 employees. It's employee heavy because these are the folks that answer the phones, that go out. They're 4,000, and it's 120 offices across the state. By the way, they were all open all during COVID, so at the very least, people could bring in their documents. All the offices are open. We did have 2 that got flooded out, but they are open. The second one is opening tomorrow. So yeah, and so we should be fully functional again relative to the flood in eastern Kentucky. The other pieces, so grants, loans, and benefits, you've seen these pieces before. That's money that goes out to individuals and organizations, and in this case, it's a lot of individuals. Childcare, SNAP is in here, TANF is in here. So these are really pass-through funds that go to communities. And then by program, again, you'll just see which are the larger programs in DCBS. I realize some of this is an eye check, but this kind of gives you a flavor that there are departments in the cabinet that have lots of programs. DCBS is one of them. When public health presents, it's just this wide umbrella of services for public health. But DCBS also has a pretty broad set of services. I'm going to get in the weeds for just a second on this one. Kentucky, unlike a lot of other states, and I think it's part of the reason why we're here and talking about structure of the cabinet, Kentucky has several things that are different from many other states. We talked about it last in Medicaid. Kentucky is a broad umbrella. We have what's called an integrated eligibility system. And so that meaning that, in connecting, which used to be Benefund is now Connect Benefits, you have TANF and SNAP and childcare, and you can get to Medicaid. So all of that falls under one umbrella. A lot of states don't have that because the departments are located in different cabinets. The other difference in Kentucky is that depending upon where you are, and I'll give two alternate examples, New York and Texas, right? They are what you call county-based systems, where a lot of the money flows to individual counties and really the state's just a pass-through. It does give more local control in some ways, but it also then means you don't have a consistent program across the state. And a lot of those states then have bigger counties than we do. So I think the atomizing of that would be troublesome for us, but there are other models. So when I've gone and I've had like consultants come in, I'm like, okay, we're a statewide system. We look a little like HSS, right? We're a big organization and we're a statewide system. Now, do you understand that before you tell me or give me your good ideas? Because it's so important to understand that that's really a critical piece to understanding the structure in Kentucky. And we're a little different. I don't know how many states are like that, but I think kind of putting on an IEES, a statewide structure, a large umbrella cabinet that includes Medicaid and social services, we're pretty unique once you break all those pieces down. So I wanted to give you a kind of what that structure looks like in Kentucky and how it might be a little different, because part of what we're talking about today is structure. And it's hard to get your head around unless you've been to another state and ask them how they do it. And even some of those other states don't understand how different it is of how they do things. So I'm happy to talk a little more about that if you have questions about it, but I just wanted to give you that broad piece. Lisa?
All right. Thank you again for the opportunity to be here, and good afternoon. So what you have here on the screen is a snapshot of all of the many programs and services provided by DCBS. These include determining eligibility for Medicaid, administering our SNAP, TANF, and LIHEAP programs, as well as CCAP, or Child Care Assistance Program, and Child and Adult Protective Services, Foster and Adoptive Services, and Independent Living Programs, as well as many others that are listed here. I won't read them all to you. But as you can see, there are a number of different programs that are administered by the department. What I would note, and what you don't see here, but you will next year, is the new Employee Child Care Assistance Partnership Program, as we are currently implementing that as a result of passage of House Bill 499, and we'll talk a little bit more about that in another slide. And here, our Division of Protection and Permanency provides programs and services related to child and adult protection and foster and adoptive services. The division is responsible for policy development and oversight of contracts, training, and consultation, stakeholder engagement, and quality assurance activities. And as you can see, some of those activities are listed here on that slide. We'll take just a minute to highlight a few items. The department has worked diligently to incorporate the voice of those with lived experience. Those individuals include our current and former foster youth, biological parents, including fathers. We're being very diligent in how we engage the fatherhood community, foster and adoptive parents, and fictive and relative caregivers in our evaluation and design of programs and services. To ensure that we continue structurally to capture those voices of those with lived experience, we have established a Trusted Advisor Council, a Birth Parent Advisory Council, and are working with the Commonwealth Center for Fathers and Families to establish a voice of fathers. And of course, we continue to work very closely with the Voices of the Commonwealth, which is comprised of current and foster youth who continue to advocate on the behalf of our children out of home care. In an upcoming slide,
Lisa, may I for just a second? Sorry. Voice of the Commonwealth. These are kids who are or are just leaving foster care. We met with them last week.
We did.
And you all have heard from them. They've advocated for legislation and for Senate Bill 8. Senator Adams, they were very happy about Senate
Thankful.
Bill 8. You. But they have the experience of the foster care system. Some of it's really poignant. Some of it's really hard for us to hear. Yes. But it's real. So I love meeting with them. And it was a group very similar to them that really got me. These are our kids, right? And we owe them our best. And unfortunately, that's not what we always deliver, but we do. So I just wanted to put that out there. Thanks, Lisa. Sorry.
That's fine. In an upcoming slide, we'll talk more about this, but I just wanted to take a minute here to note the work that our Division of Protection and Permanency has done in regards to prevention services. We are continually expanding prevention services since the implementation of Family First Prevention Services Act in October of 2019. These programs include family preservation programs, FPP, K-STEP, and START as well. We are expanding other programs to include things such as MST, Intercept, and more. Like I said, we'll discuss that further in an upcoming slide. One last point before we move on this slide. The division has also done a lot of work to continue to provide support to foster youth as they transition to adulthood. Our Transitional Services Branch utilized the pandemic aid to support current and former foster youth ages 18 to 22 to meet needs such as housing, school debts, help with technology, car payments and repairs, as well as even help to some youth purchase vehicles with that, with those pandemic funds. So this is another group that we continue to work towards providing better support around as they transition from out-of-home care to young adults. Here on this slide, you will see the number of children in the custody of or committed to the cabinet for state fiscal years of June 2016 through June of 2022. As of June of 2022, there were 8,684 children in the state's custody, and as you can see from the slide, that has been a downward trend of children placed in out-of-home care since around early 2020. We have not seen the number of children in out-of-home care this low, probably in the last nearly 4 years. However, it is important to note that our practices around placements changed as of 2019. So when discussing this data, we're not comparing necessarily the same data, or like we often say, we're not comparing apples to apples. And to explain that a little further, prior to 2019, it was common in Kentucky for relative caregivers to be given custody of children directly, and then those children were placed with the relative and were not reflected in our out-of-home care data, such as what you're seeing here. In April of 2019, Kentucky implemented a new relative service array, which established a pathway for relative and fictive kin caregivers to become an approved foster parent and to be able to receive all of the supports that came along with being an approved foster parent. Relative and fictive kin caregivers now have the option of caring for the child placed with them as a foster parent and receiving, again, those supports from the cabinet while the child is legally considered to be in our custody. So in August of 2016, the first data point on this chart, only 336 of the 7,894 children that were in out-of-home care at that time were placed with relatives, which is about 4.3% of the out-of-home care population in 2016. By contrast, in May of this year, 1,494 of the 8,760 children that we currently have in foster care are placed with relative or fictive kin caregivers, which is approximately 17%. So if we were practicing the same way we were in 2016, and these children were placed directly with relatives or fictive kin caregivers and not counted as part of our out-of-home care numbers, today our out-of-home care numbers would be just around 7,200, which is lower than what we were in 2016. Again, if we were not counting those children that were placed with relative fictive kin caregivers in our out-of-home care population. Also, I wanted to add here, I think during our presentation before the Child Welfare Advisory and Oversight Committee a couple weeks back, we were asked to separate out the relative fictive kin population, and we were able to do that. So of the again, of the 8,684 children that we currently have in out-of-home care, 1,494 are in foster care and placed with a relative, fictive kin caregiver. And of that 1,494, 1,271 are placed with a relative, and 223 were placed with a fictive kin caregiver. So just wanted to share that. And then one last thing on this slide. I would note that as children have returned to in-person instruction, we have not seen the entries in out-of-home care to increase significantly. So our out-of-home care numbers we've not seen an increase as we have transitioned out of the pandemic.
I just want to add that it has been very intentional to look at how do we increase support for family members and fictive kin for the children who are not need high acuity, to be able to stay them and to minimize the children that stay in residential. That's part of that primary secondary effort. What we want to do is support kids in community and build responses in community partners. There are always going to be children who are high acuity and are going to need at least short-term residential facilities. And the family cannot deal with them, etc. However, that should be smaller and smaller, and we continue to see this trend as we increase community support, community partners, and continue to increase the outreach to family and fictive kin to be able to get the support they need, which they were not getting before, to be able to keep the children as if they were a foster family that was not related to the child. So just some specific intentional strategy around that. Children do better when they're in family, and if they're safe and the family is willing to take them on, we want to continue that trend.
All right. On this slide, it is looking at reports that met acceptance criteria for a child abuse and or neglect assessment in state fiscal years 2020, 2021, and 2022. And the orange line there is state fiscal year 2022. Although Child Protective Service reports that met acceptance criteria have risen slightly since school and businesses resumed mostly in-person services, the numbers of referrals are still much lower than they were prior to the pandemic. From this slide, you can see the impact of the pandemic on referrals that began around 2020. We began seeing a decrease in the number of referrals received by the agency. But as you can see in state fiscal year 2021 and 2022, these intakes have remained relatively flat and have not returned, again, to the pre-pandemic levels, even after children have returned to in-person instruction. However, we would note here that while the numbers of referrals haven't increased significantly, we have seen, and our partners are sharing with us as well, that the intensity of the cases have increased, especially around the behavioral health needs of children and families.
How I've said that is, and it's unfortunate, but if child providers of children's services will echo this, what we're seeing is more severe, right? If a child's was in a good situation or even a marginal situation, wasn't getting worse without having eyes, right, on that child. But a child that was not in a good situation, without those eyes on them, what we're seeing, what gets revealed a year later, 2 years later, is far more severe. And you ask any provider of children's protective services and they will tell you that.
And this slide is looking at the comparison of Child Protective Services intakes for state fiscal years 2021 and 22. And it shows the breakdown of all referrals that come into the Child Welfare Agency. The first set of columns is looking at all intakes, all Child Protective Services reports or calls into our agency regardless of content. So, for example, in state fiscal year 2022, the department received 121,607, over 121,000 calls into the agency. Sorry. So we received that many calls or reports into the agency. The second column is looking at all child protective responses. Now, these do not necessarily have allegations of child abuse or neglect. We get a lot of court-ordered referrals or custody evaluations, home evaluations, or requests to assist with law enforcement. And so out of that 121,000 calls in state's fiscal year 2022, just over 98,000 of those had some type of CPS response involved in them. And then the next set of columns looks at the number of intakes that contained an allegation of child abuse or neglect. So again, in state fiscal year 22, out of the over 121,000 calls received by the agency, 96,978 had an allegation of child abuse or neglect. And then the fourth set of columns looks at the reports that met acceptance criteria or were screened in meeting our statutory definition of abuse or neglect. And then the next to last column is the number of reports that received a substantiated or services needed finding. And then the last column just separates out how many of those received a substantiated finding versus a services needed finding. So in state fiscal year 2022, 41% of the intakes received by the department contained some type of allegations of abuse and neglect, and 33% of those original intakes met acceptance criteria for an investigation, and only 8% resulted in a substantiated or services needed finding in which the cabinet would provide ongoing services to families. The vast majority of referrals that are coming into the cabinet do not meet the statutory requirement for the cabinet to take action, which is a missed opportunity for prevention if we don't respond differently. And this is why DCBS is so committed to increasing our primary and secondary prevention efforts, which our commissioner is going to talk more about now.
So our work now is we are one of the few states who have a mandatory reporting, as you know. So if you suspect something, you report it. Then it's up to us to investigate and to decide whether it meets criteria or not. In the meantime, there's all these families who have issues. There was something going on, that's why they got reported, that we have not intentionally been able to provide services and referrals to keep them from coming to the system. We don't want folks to be traumatized and become part of a system that is difficult to navigate. So our work is really moving from tertiary prevention, which is the prevention that you do to keep people from continuing to deteriorate, to prevention of those who we know there's an issue, but they don't meet criteria. But if we don't intervene, or our families do not intervene, offer support. For example, we know now statistically that when we offer financial support, right, to families, the decrease it directly influences child maltreatment. So we know that there's lots of need out there that for folks before they get to us that we need to be responsive of, and that's the big thank you to the Division of Prevention, Senator Meredith, as well as Senator Meath. We have 3 branches in the Division of Prevention. It just became official. Thank you very much. And those branches are primary prevention, which means the whole community, right? Without community and without community partners, there is no primary prevention. It's kind of like when you have cancer, right? So we do prevention work around sunscreens and about being able to have tests and all that. They don't have to come to us to be able to do that. Secondary is something already happened, right? And they got reported to us. How do we keep them from continuing to go downstream to end up in protection and permanency? And what do we need to do that? So this division, we're in the process of hiring the director of that, will have a primary and secondary prevention effort in that. And it has three branches: primary prevention, prevention on evidence-based practice, best practice nationally is around prevention, and community response and well-being. Again, we have been working for a year with a prevention collaborative across the state to be able to be ready for this prevention work, to begin by engaging our partners is what is primary, what is secondary, what do you do? And as we decrease residential, which is what we want to keep doing, how do we increase support in community? How do we add wraparound services in community, for example, like crisis response, to be able to keep families for continuing to deteriorate? Because by the time they get to us, usually they have resources, they have totally outrun their resources, and they're in major crisis. So we want to keep people from coming into DCBS, into CPS. That's the goal of this unit, and we're very excited about that. Again, the General Assembly approved the division. Senator Meredith, appreciate that. Meade was also very instrumental in helping us get funding to begin that work. And we are incredibly excited and hope to continue to see residential decrease, increase in family and fictive kin services, improvement in community wraparound services. When folks choose get out of residential, we know that they might do well in residential, but then they go back to the community and nobody else has changed, right? So our work is, how do we do that transition? How do we work with our residential partners to make sure this happens early? How do we do testing, see whether youth and foster families and biological families and fictive kin are ready to take this child in? So that's a lot of where that work will be. Financially, we know that when we prioritize prevention services, we see a much larger decrease in expenditures downstream related to costs associated for providing out-of-home care. Residential is expensive. It's not only restricted to our youth and families, but it's expensive. From 2019 to 2022, our prevention expenses increased 11.4 million, and our out-of-home care expenditures decreased $79.1 million. So the numbers tell us that it is smart to invest in prevention. It not only decreases trauma, but it increases community involvement, and it decreases the cost to the state. So we are very grateful and excited about really increasing our ability to do that. I think you have family support?
Yeah, I'd like to do one more thing on prevention.
Okay.
So Representative Meade put some funding in previous year's budget, $20 million for prevention. We spent about 12 of it. And like the hospital reinsurance program, that a large portion of that money was used to increase rates for child caring facilities. I think the whole system would have collapsed without that funding. So it is a testament to Representative Meade's foresight to put that funding in around prevention. I don't think we knew exactly how we were going to use it when it came in the budget. I understand that, and we didn't. And some of it we were unable to use because people had trouble hiring folks just like everybody else. But some of that funding was critical, absolutely critical for shoring up an industry. Like HRIP of this morning helped shore up the hospitals. This prevention money, and I'm not going to go all the way down in the weeds on it, but it was to make sure that all these facilities could meet the new standards for providing some of this out-of-home care. This funding supported that, and like I say, probably saved the industry.
Well, and it allowed us then to have the time to go back in and offer increased rates for our residential partners who really needed it. They need to hire staff. You know, again, the youth that we're getting is higher acuity, and I will talk more about that. So they need more specialized and trained staff. And I want to clarify, because there's some concern that has been voiced before about qualified residential treatment programs are in our budget. It's line item 17. It's not that we're coming back to you and asking you for more money. You already appropriated that. So we used those funds to help shore up our partners and for them to for those who are qualified residential folks. So we are there in line item 17 of the budget that you approve, and we appreciated that. Family support?
Yeah. All right. The Division of Family Support administers programs to support families and individuals in need. They provide those critical safety net programs and they are part of our prevention continuum. We seen during the pandemic what a lifeline these safety net programs were to so many families. Also, many of these programs are those economic and concrete supports that keep families intact and from coming to the attention of the Child Welfare Agency. Our Division of Family Support has 5 branches, which you see here on the slide with a description of what those are. I'll highlight a couple of things within the division. They are responsible again for the oversight of the Supplemental Nutrition Assistance Program, or more commonly called SNAP. SNAP provides low-income individuals assistance with purchasing food and works to address food insecurities. 12.1% of Kentuckians received SNAP in April of this year, which included 226 children and 62,000 elderly individuals. $1.4 billion in federally funded SNAP benefits were spent in Kentucky retailers in state fiscal year of 2022. So again, this program is not only good for families and good for children, but also brings money into the state that goes directly to retailers and supports our economy. Family Support also administers the temporary assistance for needy families, the TANF programs, which includes KTAP, Kentucky Works, and supportive services. And they also administer the federally funded LIHEAP program, which provides assistance to vulnerable populations in Kentucky with their utility bills. Just over 303,000 households received LIHEAP assistance in state fiscal year 21 across all 120 of Kentucky's counties. And then last year, we used the American Rescue Plan Act funds were used to create a water utility assistance program, which was completely federally funded, and we modeled it after our LIHEAP program. This LIWAP, I think what we called it, program helped families in need pay for water and or wastewater utility bills. All these funds that were available through ARPA have been expended and for this program in Kentucky, and they were quickly dispersed to families showing the need for such a program. And lastly, the Division of Family Support will be working closely with the department and the cabinet leadership to implement House Bill 7. We have the reg amendments have been filed. And we are requesting the waivers as part of House Bill 7 for SNAP by December 1st, and reporting requirements for CCAP and the online public assistance calculator and online job postings will be ready to be shared by September 1st, and we'll also be sharing that information at the Benefit Cliff Task Force in September.
So I get to present the Community Services Block Grant, and the reason I'm doing that is when I was working for Louisville Metro, I was actually a Community Action Agency director because Louisville is the only municipal community action agency in the state. So CSBG is funding that flows directly to the community action agencies. Your local community action agencies a lot of their funds come through the CSBG program. They serve families. Those of you who know the good works of your local community action agency know that they really make an impact on the community. They work towards individuals towards self-sufficiency. They administer the low energy heating assistance program. We're running a cooling period this year because there was additional funding there and we've been able to extend it. I'm almost of the opinion that the cooling period anymore is going to be more important than the heating period. The water program is something when I was working, again, in the city, so I'm just coming from that perspective. One of the things we had trouble when we were trying to rehouse people was folks would have like old water bills, right, or old sewer bills, and there was really no way to help pay them off. This has gone a long way to help pay off some of those really what have been kind of old debts that folks haven't been able to to get rehoused. So this has been a really important part of some of the homeless programs. And these agencies, they all have their individual plans. I guess they're the forerunner to family resource centers, and that they come up with local plans for how they're going to use these funds. No two are really alike. They all learn from each other. Some of them administer some of the Head Start programs, some of them don't. So it's each community action agency is a little different. It's done by design. This is, again, a capped grant, but if not for them, helping us provide services in all the counties, what they do on the local level makes a tremendous difference across the Commonwealth. And like everybody else, each one is different. You know, some are better than others. You know, nobody likes to hear me say that, but it's true about any organization. It's true about our offices. You know, it's just true. But they all do great work in the community and important work in the community.
And I'm very aware of time and want to make sure that it's time for questions. So I think just highlighting a couple of things from each of the slides we got left. And I assume we need to end at 4. Is that correct?
4:30. So
Oh, we're good.
I think childcare is important.
Yeah.
Oh, all of it is crucial. I just thought we were over here by 4 o'clock. So thank you.
All right. Within the Division of Child Care, we currently have just over 2,000 active child care providers, licensed, certified, and registered, and just over 30,000 children enrolled in the Child Care Assistance Program, which provides assistance for low-income working families with the cost of child care. And 75% of our providers, just over 1,600, are participating in the CCAP program. The department increased the provider reimbursement rate twice recently in July of 2021 with House Bill 405 appropriated $12 million to increase child care provider CCAP reimbursement rates. And then in October of 2021, we used ARPA funds to increase the rate again to 80% of the market rate. And we are currently using ARPA funds to pay CCAP families' tuition up to, again, that 80% of the market rate. We also use the ARPA funds to support our child care providers in a number of other ways. We are currently providing sustainability payments to providers. And then we also are offering business partnership startup grants, which provides up to $100,000 in matching funds to open employer-based child care sites. We currently have received 3 applications and in 2 different counties. We are also using the ARPA funding to offer facility repair grants to our providers. These grants can be up to $10,000, and we have issued somewhere between 6 and 17. We've received somewhere between 600 and 700 of those applications. Also, we are using the funding to support child care desert startup grants. We currently have received 15 of those applications in 10 different counties. And then also are supporting family child care startup grants. We have received 16 applications for those in 8 different counties. And then we are also using this funding to help with child care teacher credentialing and have assisted with 410 teacher certifications.
The reason I wanted to highlight this is this morning I testified, what are the things we're worried about for the next budget? As you can see, there's a lot of ARPA fund here. So this is the non-recurring piece that I think will be a challenge in the next budget relative to daycare. So I just wanted to highlight that for you because some of these are really, I love the business partnership pieces, the child care startup grants, the family care startup grants. That's what we should be doing. I think it encourages entrepreneurship, which I think we all support, and it's a very different way of doing things. And I'm hoping that this works out. We don't know yet. Some of the business pieces you heard 3. That's because we started in July. But so these are all kind of new things for us, and doing things a little different. And we have the opportunity because of the ARPA funds. But that was the question we talked about this morning is what are you worried about moving forward? And this is one of them.
In addition to increasing the provider reimbursement rates in 2021, ARPA funds were used to implement a 3-month transitional period for families upon exiting the CCAP program in order to attempt to address a very large child care benefits cliff. During this transitional period, the family continues to receive child care assistance at a rate of 50% of the cost. And we, effective in September, we are increasing that transitional period, expanding it from 3 months to 6 months. Also, we increased the CCAP initial eligibility twice in January, then again in July. In January 2022, we increased the eligibility threshold from 160% of the federal poverty level to 200% of the federal poverty level. And then again in July, we increased from 200% of the FPL to 85% of the state median income, which allowed more families, by making this change from 200% of the FPL to 85% of the state median income, it allowed more families to be eligible for CCAP and aligned our income guidelines for recertification periods. The chart within this slide shows the difference, but to provide you with an example, a 2-family household, which would consist of a single mom and a child, the CCAP cutoff at 200% of the FPL would have been approximately $34,836 annually. By expanding to 85% of the state median income, the cutoff for that same family is $44,916.
And the piece here again, remember these are ARPA funds. It's very important. Representative Moser, I think the benefits cliff, the last benefits cliff, what we identified was childcare is the big one. And so working on some of this as how to lessen that cliff is we'll have an experiment for you. We'll have a we'll see for you, but it will also be how much would that cost for us to move forward?
We will be submitting a report on CCAP eligibility data by September 1st of this year, and also presenting this data to the Benefits Cliff Task Force in September. But here is what we've seen so far. From expanding the eligibility from 160% to 200% of the federal poverty level for the periods of January 1st through July 30th, financial assistance in attending child care has been provided for an additional 1,293 children in Kentucky. Since beginning the transitional exit period in March through the end of June, the benefit cliff piece, 56 children have benefited from still receiving some assistance with child care payments. And looking at our data just recently, up to 80 children total were receiving a benefit from the transitional period by mid-July, showing that that it's an increasing need of serving more children. And I think we've already touched on this a little bit, but I think everyone here understands that the cost of child care typically makes up a large percentage of a family's expenses, and the impact that these costs have on lower and middle class families who are making employment decisions are substantial, which highlights the importance of programs that assist families like the Employee Child Care Assistance Partnership established in House Bill 499. This program creates a public and private partnership pilot that incentivizes employers to contribute towards the child care cost of their employees. It is matched by state general funds established in a trust just for this program, with the match dependent on the employee's household income. We are currently in the process of implementing House Bill 499. We've had multiple peer-to-peer calls with other states who have similar programs and learning from them. And we are in the preliminary stages of drafting the required regulations and standardized contracts. We will begin accepting applications in April of 2023 and begin issuing payments in July of 2023.
This is a review for some of you. Just want to, we have a lot of employees and we've had high turnover and a lot of traumatizing work because of what our staff does. So just wanted to remind you of some of the work that we have been doing since I came here 2 years ago. We developed a 6-month stabilization from COVID being a crisis to how do we work during COVID, and we completed that successfully. Then we had over 100 folks who were had received services from us, biological families, fictician grandparents, and youth who had left our system or who were in our system, as well as key community partners. And we had a lot of discussion about what a 21st century DCBS would look like. Basically, how do we decrease barriers to access to services, and how do we increase access and the voice of the lived experience of those we serve so that we don't make policy decisions with those who are affected by our work. We did that, and that plan goes into effect this August, and that's the Innovation 18-month strategic plan where input was given into this will be easier for us. This is where you need the voice, etc. We also instituted a trusted advisors. Now they were part of this strategic planning as well as frontline staff, as opposed to us in leadership making up the plan and saying sign here. This was a very collaborative, facilitated process. We now have added dates and budget item cost, as well as team members who are responsible, and we will distribute that to everyone across our agency. So we're very excited about that. The next phase for the agency then is we evaluate all the way what's working, what's not working, and what works we're going to stabilize into a 3-year stabilization plan for the agency. So the vision for this is both robust in person and virtual. Just to remind everyone, we have never not had folks see people, even in the height of COVID, the folks met in porches and in parks and in backyards, but anybody who was at risk or any assessments that we have were done. Then we began to increase the amount of people that were in public-facing offices so that clients and communities had time to be able to do that. And then this hybrid model allows us to create a benefit, which is more of a work-life balance. So you might be 2 or 3 days in the office, 2 days working virtually, doing research or meeting with families, telehealth, and be able to get out of the fire for a little bit. To be able to go back in as you do that. So we were able to be more flexible. We have modernized the physical spaces. I would say that this is a joke that you might not like, but I like to tell it because I'm old and I get to. Goodwill took an acid trip and they donated the furniture to DCBS. So we've had duct tape, we have broken furniture, we have mold, we have had an incredible amount. So we have been going through buildings, furniture, and trying to use furniture that was not from 1950 that actually worked, as well as reducing the brick and mortar, increasing IT, and giving people more open spaces so they can come into work, share spaces, as opposed to come and lock yourself up in an office, share space, have more community, etc. So that's a big shift for our staff. It has been well received in regards to the flexibility, and we're working to continue to provide both robust in-person and robust in IT support for that. We have incorporated the trusted advisors. They're not only advisors now, they will are permanent part of us. They are now a council, and thus was folks representing the lived experience. We serve the whole state, so not everybody can be on there. So these will rotate every 2 years, and new folks from different areas will be coming in. So DCBS will have the lived experience integrated into how we do our work, to hold us accountable for a strategic plan that they help to design, to help us with the evaluation, to continue to receive input, and for frontline staff and those who receive our services to be working together and leadership being there to support and make the work happen. So we're very excited about that becoming an actual council and institutionalized. That's being facilitated by Kentucky Youth Advocates. And we were able to get funding to pay those folks to serve those services. This is really a living example of who we are, what we do, and what we value. So the challenges that we have continuous exposure to multiple traumatic events. Just like our clients have higher acuity of need, our staff has higher acuity of needs. And there's been an incredible increase in the safety risks for our staff, more than we've ever had. High-risk positions similar to emergency personnel and police, toxic stress, of course, burnout, as well as vicarious trauma and compassion fatigue. And then we have the secondary post-traumatic stress disorder, the stories, right? The families that we see impact us. And the minute they stop impacting us, we should quit and hire other people. These are horrific lives, horrific challenges that our families and our communities have. And the work capacity, retention, and turnover has been an astronomical challenge for us. We lost like 600 staff in 3 or 4 months. We have just begun to move that needle as a result of some of the things we've done, and I'll tell you what those are. Workforce turnover, 2020, 12.93%, 2021, 20.41%. This is when everybody figured out that they can make a lot more money and not be traumatized by not working for us. And people retired because they could, and people started working in hospitality industries and gone to other partners. In 2022, total between this January and June is at 7.88%. We have been successful in being able to attract family support folks. We're struggling with protection and permanency folks. We have not moved the needle as far as we thought we would. So we've worked to address this by increasing entry-level salaries, as you know that. The governor provided raises for specific classifications that had high turnover, those folks that are in the front, boots on the ground doing the work. The General Assembly, you all provided raises for specific classification in our bill. Thank you, much needed, way overdue, incredibly helpful. So that 8% raise for all state employees has gone a long way to retain and to increase morale. Other efforts that we have made is we've seen a decline in workforce turnover, and we have included in task force and equity work around pay equity and pay gap. Of course, when we did these raises, we have this system that hasn't provided regular ongoing raises. So we have an incredible amount of compression, an incredible amount of somebody who's maybe a supervisor or a director making less than somebody walking in the door. So we are dealing with all of that, but we had to make the right decision. This was the right decision, and we're cleaning that up, and we meet regularly to be able to do that. So
I like to just say, taking the first step. We can't let perfection get in the way of taking the first step, right? We knew we were going to have compression. We knew we were going to have some salary inequities. We knew it, but we knew we couldn't do it all at once. So taking the first step, probably making some people upset. I mean, that's just true. But if we didn't take the first step, then we weren't going to get anywhere.
Yeah, so we have a big mess to clean up.
But the other,
it's on us to do that.
Right. The other side of this is, as you can see, what we can say on the social worker side is, we're not at 40% turnover, right? We've slowed that down. We're kind of stopping the absolute arterial bleeding, but we've got work to do, and that's just true.
So let me
interrupt you just
Yeah.
very brief. You're doing a fantastic job covering a lot of material, but I'd like to have a hard cutoff of 4:30 today. So if we could wrap up your all's presentation and give us an
Yeah.
opportunity for some questions, I would appreciate
Sure.
that. And I know you're almost there, but just wanted to kind
Almost
of
there.
move that just a
I
little
like
bit.
I like you all to review. I won't go through it. The exit reasons, that slide, as well as what we have been doing. For example, locality premium, flexible work schedules, interim hiring process, so it doesn't take 2 months to be able to get a position once you have somebody that you want to hire. We started It's a New Day campaign for recruitment and retention, where our staff is coming back, some of folks who resigned and all of that. So please, if you would look at that, I won't go through it, and look at the exit reasons. We do exit interviews on everyone. I want to bring your attention lastly, and this is my last piece, is you need to be aware that we have an incredible issue with high acuity youth. We've always had youth who needed extra support and extra help, and who were dealing with psychological, behavioral, and issues. However, for multiple reasons, right, we have had an increase in those high acuity youth at the same time that our partners have not been able to accommodate them because of their own lack of staff and their own facile silences. So I wanted to let you know that these are mostly adolescents. They're committed to the cabinet for dependency. Remember, we're not able to take any child without court approval. So these folks are in high need. They usually are aggressive, so some of the agencies will not take them back because they have harmed a nurse, so they have threatened, etc. And of course, this happens with a family or the foster family first, but then it's happening in our residential as well. So aggression, intellectual disabilities, autism, co-occurring physical health conditions, and problematic sexual acting out behavior are the primary pieces. So here's a case description. I'm not going to go through that, but just so that you have an idea of what we mean when we say high acuity. And what I wanted to tell you is that we've developed a work group for the short term. For example, we have children staying in our offices with staff who's not prepared to take care of a high acuity child on inflatable mattresses because they have no other place to go. That is a bomb waiting to explode in regards for that youth or for that staff member. So we have hired officers that can help that. We've created cards for food and clothing, etc. Long term, we've put together the MCOs. Our medical director, Dr. Lohr, is leading MCOs, Hospital Association, Medicaid, and residential folks are coming out at a structural and systemic way that we can address this and keep this from happening. And we will be back to you more on this issue. But we had not mentioned it. We're struggling with it. The country's struggling with it. And we wanted you to know that the needs are severe, and this youth are going to need our arms around them. And the folks who take care of them are going to need our support so that they can have the right staff to be able to make sure that these youth get taken care of. So thank you for all your support, for your budget, for the support of, that you have given us, and for your belief that we can get ahead of this and work upstream and decrease the amount of crisis that we have in our agency and the amount of turnover that we have in our agency. Very grateful for your support.
Grateful for your presentation. Before we get into questions, let me do kind of a brief recap for our committee as to how we got here to begin with. When this was first announced, people immediately said, well, you're going to split the cabinet apart. Tried that before, it didn't work. You know, I'll tell you, that's a possibility, but I don't think that's going to happen. Could be a recommendation, but this is not so much how the cabinet's doing their work, but how we do our work. And part of the reason that this resolution was filed was because our agenda is growing for our committees on health and family services, certainly our committees for Medicaid oversight, which we do just, we don't have any authority to pass bills out of that committee, as well as child welfare oversight. And certainly that was reinforced when you went through Child Protective Services today. There's just so much to do. We've only got so much bandwidth. So this exercise we're going through, as much as how can we do our business better, as well as how can we help the cabinet to do their business better. And it looks like we're ripe with opportunities to do that. But just to remind that it's just not about you folks, it's about how we do our business as well. And with that, I would open the floor for questions. And I'll start if you don't mind. I guess it's chairman prerogative. Let's go to page 3. Because again, the reason you folks are here primarily is because of the size of this particular department. First question I have is the structure of the districts, 9 districts, is how did that come about? And let me give you my background as to why I'm asking that. Is I like to see things kind of perfectly aligned if you can do that. And I wonder why we're not aligned with the area development districts rather than 9 districts that may cross area development district lines. But do you have any history on that?
I have a little. I don't know, Lisa, if you're going to be able to help. When the cabinet was split, so this is back in the days when the cabinet was split, there was a view to, and this is, I was not in this side of the cabinet, so this is a little bit of hearsay. It was really looking at workload and number of folks who were coming through DCBS offices, and an attempt to balance kind of workload. There were discussions back then of shouldn't we line up with area development districts, but the Secretary of Families and Children at that time, Secretary Miller, really wanted to balance relative to office number of folks served is my memory of it. Lisa, am I close?
You are.
Okay.
That's my memory as well.
So I think that it goes a ways back, but that's the reason why we in the Cabinet for Health Services side, under Secretary Morris, really did follow more the area development district model.
And that reorganization happened around 2006. And we, at that point, I believe, were 16 service regions.
Mm-hmm.
And the reorg we brought this structure forward at 9.
Right. Thank you. I forgot that. Originally, there were 16 of these districts, and that's why some of the names are particularly strange, as they tried to combine names. And it was an attempt just to consolidate those folks who were sort of in charge over regions. That's right. I forgot about that.
Mm-hmm.
I think that may be something that would warrant additional conversation, so I
Yes.
appreciate that. Explain to me what an interim employee is.
Sure, I can do that. Interim employees are individuals that we bring on. They are, we have our interim hiring process, this is the largest number, I think, of interim hires that we've had previously. So there's two different types of interim. So one is an interim employee is someone who has left the agency, retired, but wants to come back and help support the work of the department. So we can bring them on as an interim 9-month employee. Again, they work for us for a period of 9 months, and then they would leave and then come back. So we have a lot of interest from retired employees or employees who have left who they don't receive benefits, so that they don't need benefits, and they can work part-time. There's more flexibility with their schedule, et cetera. The other interim employees that the commissioner mentioned a minute ago is that in December we implemented an interim hiring process that helps us with onboarding of our staff more quickly. You've heard, I think, us talk about in the past, it can take a month or longer to interview, hire, and bring a new employee into the state system as a certified employee. So the interim hiring process enables us for the individual to apply for the position, us to interview them, and quickly onboard them as an interim position while we are working through the personnel side of finalizing all that, the paperwork and the process to bring them into a permanent full-time position. We have seen a lot of success with that interim hiring process, particularly around the family support positions, those that are determining eligibility for benefits. Not as much much on the social work side, but we have had some there as well. But it is helping us onboard employees much more quickly.
So Senator Merritt, this was an intentional strategy to try to recruit employees, because you would interview someone, you wanted them for the position, then you would have to wait 2 months, sometimes longer, to be able to get that person onboarded and working. We couldn't afford that with the kind of hemorrhaging that we were having. So this was approved as a process. If you're good enough to be hired, you've gone through the interview process, we can hire us at Interim while OHRM and personnel go through all the administrative pieces for you to become a permanent employee.
And oftentimes, after we would complete that interview process, we would go back to the prospective employee, and they, because it took the amount of time that too long, then we would go back to the prospective employee, and they would have accepted a job somewhere else because they are looking and interviewing, and so we were losing candidates because of the hiring process and the length of time it took to bring them on board.
So we've kind of created a workaround.
Yes. Yes.
And I know Secretary Freeland, you've heard me say this on numerous occasions. We need to run state government like a business. And to take a month to hire someone
Or
is
longer.
not or longer does not happen in the real business world. You can't afford to do that, and creates inefficiencies in itself. So I'm not sure how to address this other than our whole hiring practice, and this goes beyond the scope of what you folks do. Maybe it goes to the personnel cabinet. Is we may have to have a significant revamp of that if we want our state government to be more nimble, able to fill these slots, because this personnel drain that we're seeing, we all understand the costs associated with that, not just in terms of dollars, but the ability to provide services, needed services to our families, and that's just not right to have that bureaucracy in place where it takes months to hire someone, because as you said, they've got choices today. And they can go, nobody's going to wait around for 2 or 3 months to see if they're going
Right.
to get a job or not.
And we are also working on those processes as well. We found some efficiencies within our hiring system, and we'll continue to work on that. And I'm sure we'll be able to report, I hope, on some improvements there as well.
Well, this one has got my attention. It's disturbing, particularly if we need 4,500 employees. We only have 4,000, and 112 of them are interim, and just something's not working. But something that just came up yesterday, and sorry, committee, if I digress a little bit, but my email has just been exploding this week over this telecommute
Yes.
policy
I see.
change. And for some reason, it go back to me. I don't know why. I'm going to plead to me a couple here. I'm innocent. But it did come up in our Government Contract Review Committee meeting, because I was co-chair of that. One of the things I hate, and you folks well know, are retroactive requests for approval of contract. Because we're supposed to approve funds before they're spent, not after. And when I came to the committee in 2018, we were seeing dozens of these contracts, and now we have pretty much controlled it. I rarely see one, but this last month we had 6 contracts from Education Workforce Development. And they have to provide us a letter as to why they're asking for retroactive approval. And one of their bullet points as to why we were getting a retroactive request was that they said the telecommute policy was not conducive to the workload of that cabinet. And I said, well, then you need to get people back to work. And apparently that's blown into, well, legislature now says we're not going to be able to telecommute at all. And I know that you all have had a change in your policy.
Yes.
So just let it go on the record. I support it. I think it's a good program if structures are in place to make sure
Yes.
there's accountability for employees and we can measure workload. And I can see where it could be a tremendous recruitment tool. So can you speak to that just a
Sure,
little bit?
I'm happy to speak to that. So I actually recorded a video Friday, communicated with staff in the cabinet, and what we've done is there's a statewide policy that's been implemented, I think, that addresses some of those concerns. So those folks who are on hybrid schedules, right? And we have folks who probably don't need to be in the office every day, but we are implementing a statewide policy because, each cabinet was doing a little bit different. So we are going to require folks to be in 3 days a week. Many employees view that as a loss. I'll just be straight up with you. It's probably why
Yes,
you got
they
a
do.
million emails. But it is about making sure that we're consistent across state government, across cabinets. It is making sure that, and I believe we've been successful, frankly, with our telecommute policy, but bringing folks in, making sure they're there, working on culture, working on the relationships. It's always good to see, like testifying here, people actually in 3D. It's an important piece of the workplace. And so we will implement next month, a month from that announcement on Friday, and folks will start to come in 3 days a week in the cabinet. We have some really specific building issues, but that's I would love for you guys to come over and meet at the cabinet. Maybe get me another building. It's so there are some specific challenges. That's true, but we are wanting to be consistent as a state government and what that looks like. And like I said, there are folks who view that as a loss, and I'm really sorry for that. We need to be consistent. And we need to make sure we are applying what is a policy around telecommuting and hybrid schedules in a way that is consistent across cabinets. And that's what we're doing. Is that helpful?
It is, but I'm going to respectfully disagree with you.
Okay.
Because as a hospital CEO, one of the most difficult things I had to deal with was a four-letter F word, and it was fair. And to a lot of people, that means treating everybody exactly the same, and everybody's not exactly the same. And when you got a state government as large as ours is and the many employees that we have, not everybody's the same. Not everything works for them. Their jobs are so different that I don't know that one size fits all. And when we try to make one size fit all, I think it causes a dissension, I think causes morale problems, and doesn't recognize the uniqueness of each job. If telecommute can work, and I think it can be in many areas, if you had the processes and controls in place, I think it's something we should embrace. But if we're looking for a magic bullet that satisfies everybody's situation, we'll never find that. And I think that's one of the problems we have with employee turnover. You know, we have to understand that there's a great demand for human resources now, and how we're going to meet that is we have to have a little bit more flexibility than we've had in the past. And I just don't see, again, that one policy should be applied to everybody. But again, that's a discussion for another day. Let me move on because we got a lot to do. Representative Moser, please.
Thank you, Mr. Chair, and thank you very much for your presentation. I know that this is not easy to cover. You've covered a lot, and I feel like, you know, there are a lot of places where we could really spend a lot of time and dig into this. Obviously, those are conversations to continue. But in keeping to the topic of why we're here, and we're looking at systemic changes, and I know, Commissioner, you've done a lot of work to really look at hiring practices, retaining our workers, morale boosting, and how do we treat people well enough so that they want to serve our Kentucky families. I know that you touched on, well, I mean, hiring is a big piece of this, and we've heard about some of our children sleeping in DCBS offices in counties. I'm hearing from my county attorneys in our area. Have you given any thought to? I know that Kentucky is surrounded by 7 states. So how do we reconcile some of the differences in credentialing of social workers? I know that, this is a big issue. We don't have a compact for our social workers like we do with a lot of our healthcare workers. And our licensure categories are different in Kentucky than other states, and we lose social workers to surrounding states. Have you given any thought to that as a systemic kind of change that we could make in Kentucky to keep our social workers here?
When you look at it is a great idea, and we do lose folks to like Ohio, for example, on a regular basis. But really, when we look at exit, what we're looking is people's trauma. So we've implemented debriefing and secondary trauma training and groups in regards to that, as well as caseloads. So what we have is we need bodies to be able to have a caseload that someone can actually manage, and be able to not only take care of that target child, but the whole family and do all of that. So the primary issues have been around both of those. In regards to, we're very competitive and comparable in regards to the requirements that we have as opposed to what other states have. We end up losing folks to other nonprofits, for example, because they can offer a bonus that we're not able to do. And the security concerns for our staff have increased. Just like we have high acuity youth, we have clients now hurting our staff, threatening our staff, putting guns to our staff. I just had a staff member, had stitches in their head when they went on a home visit. A person who was obviously very frustrated and did not get his SNAP benefits because their income was higher, and he threatened to blow up the office. So we had to be able to do that. So I think the fact that we have an incredibly reactive communities as a result of what we've been through, as a result of the higher caseloads, the higher acuity of our clients and community are big impacts. We have some good flexibility around how we hire folks and what they do. And Lisa has been chief of staff way before I got here. I wondered if you can, and the three of us are social workers. So, at different levels and in different expertise. So I really hear what you're saying. And that may be helpful. I don't know whether that has been done before or where your stand is on that in regards to losing folks or not being able to recruit them, right? Money has been an issue. Right. Caseload has been an issue. Trauma has been an issue.
I think it's a great idea, but as far as being able to implement something like that require a licensure or certification, I think would limit our ability to hire at this point. So I think that would be the concern if we don't have some process in place to support the certification and maintaining what that would look like. I think that would be very difficult for us. Our partners across the state have difficulty hiring social workers with certain types of credentials. So we've seen that from the implementation of QRTP and other programs.
Right.
So I think that would be the challenge.
Mm-hmm.
And it's you asked a complicated question because it's a great question. There's so many sides of it.
Yes.
The Board of Social Work, right? And what those licenses and how it's much like the Board of Nursing or anything else. It's how do you attract folks and get folks through the process to get certified and licensed and registered and all of those different categories, which is blissfully not mine. But then the other piece, and the reason you heard the answer that you heard is that over time, there have been discussions about, well, if somebody's a social worker for DCBS, they need to have the degree, they need to be certified, and that's not what we have in DCBS. That's not there. We help people move towards that, but you can do the work without that specific degree or certification, and it's been proposed before. But you heard that as like, oh my gosh, we're having trouble hiring people now. We'd never hire anybody in the future. But it's a good point in terms of the expertise and skills. I'm just to be clear, not a social worker nor a physician. I sometimes get Dr. Friedlander. No, but hopefully worked around enough that I have the heart of a social worker.
Yeah. Well, and the fact that we do need them to have qualifications and experience, and we train them to do that. But right now, for example, I would love to have a lot more licensed clinical social workers that can provide clinical supervision and have a hub for those front lines, which are primarily new, and get together the sea legs. But part of it has been the pay, right?
Right. I know it's multifactorial.
Yeah,
it's
and
not
it's good
easy
one.
fix.
For us to be fully staffed and be able to prove certification and licensure as part of working for us would be an incredible improvement, and I fully would support that.
Right.
We do not have that now, and we're having a really hard time recruiting.
Okay, thank you. May I ask one more question? I know we're at time.
Yes, ma'am.
I'll try to make it quick. On the child care issue, House Bill 499, so much for your work on that. I'm very excited about this pilot. It was really very similar to our discussion last summer, all summer and fall, about the bridge insurance pilot. Really similar ideas about public-private partnerships. And I'm wondering, as we talk about that and identifying the need for really all of it, we're talking about the benefit cliff, which you discussed. Are you using a modeling program to project out the benefit? At what point an individual would drop off that benefit cliff?
So I think you may have received a presentation from Education, Workforce, and Development. We had a meeting last week. I'm honestly, last week, yesterday, last year, I don't know. But it was around the requirements for benefit cliff that were within House Bill 7 and some of those things. We're making progress. What they have, what Education, Workforce, and Development has, it's a nice tool. And it's a comprehensive tool. But we said, if somebody from the general public's going to use it, it was a little complicated. So we're in discussions with them right now about how to simplify the tool. How can we put it on like our websites so that folks will be able to use that? And can we don't know this one yet. This is down the road. And it maybe we have a first iteration and a second iteration and a third. Right. We would love it if somebody who is applying for benefits could actually use the information that they put in their application to look at that benefits cliff piece and see what happens with a salary increase. We are not there yet. We are not there yet. But we're working on it.
Okay, I'll look for that. I'm sorry that I missed it because I think I introduced you to the Georgia Center for Opportunity, and that was easy for me to understand.
Yes.
So if I can understand it, maybe anyone can. But I think it's an important tool to use. We do have to keep it simple so folks like me can understand what the benefit is, what the cliff is for individuals, and especially for people who are actually stuck in that cycle. And how do they project out what their needs are, and then how can the state project out needs and create a system that really assists them get back on their feet or
Right.
independent.
We're here to be a bridge. We're here to provide the resources to bridge folks, out of trauma, out of
Right.
poverty.
Yeah, no one wants to be stuck in this cycle.
Not good for them, not good for anyone.
Okay, thank you.
You're welcome.
You said that would be a short question. Thanks, so. Obviously, we're going to have to continue this discussion next month. Senator Alvarado will be our last question for today. But a lot of territory to cover here. Representative Meade will chair the next committee meeting. What I'm going to suggest to him is that we just do a follow-up, continue to go through these slides
Thank
because we
you.
want to cover
Thank you.
3 points. Yes, Representative Bentley.
How do we get those tours you invite us to come over and see?
Oh, tour the building.
Oh.
It's up to the
Ask us and we will take you.
Yeah, we'll be glad to do that with you.
Yes.
Absolutely.
I said there'd be a hard cutoff at 4:30, but legislative time really means 4:45. So, Dr. Alvarado, Senator Alvarado, you have the last
Thank you,
question for
Chairman.
this
Thank
session
you.
today.
Thank
but I
you.
want to encourage again, take your slides, take a look at them, and we'll continue with our questions next month, and probably dedicate the whole meeting just to
Yeah,
answering
we'll be glad to
questions
come
about this.
back and do more in depth.
I am opposing to some of the things because I do see some problems in here, and today I am going to be heard. I'm not going to leave until you hear.
No, ma'am, that's not the purpose of this committee at all. I'm sorry. No one's testifying publicly today. We're not in a position to take public comments. We're not doing that today. There'll be other opportunity. I appreciate that, but that's not the purpose of this committee. We're not hearing public comments. If you don't sit down, I'll ask security to ask you to leave the room.
So you're going to say, so I cannot speak, but I can sit here and hear CHFS.
Yes, that's what I'm saying, because that's not the purpose of this committee.
Where he's not supposed to be.
That's not the purpose of this committee.
The purpose of the meeting is what I'm saying.
You don't know what the purpose of this committee is. That's not why we're here. We're not prepared to take public comments. We need to conduct our business. If you can't respect that, we're going to ask you to leave or be removed.
Placing him someplace
Would you please remove her from the room, please?
For what reason are you taking children from their parents and then sitting here begging for money? How this is a public place.
Mr. Chairman, I can ask my question. if
I
you'd
wish
like.
you would, please.
Sure,
Let's
absolutely.
try to
So,
continue. Thank you.
Just to remind everybody, this is a task force, so it's not a this is not a committee. It's a task force tasked to take a look at organizational structure, operations, and administration
Right.
of the entire cabinet, and we're trying to find better ways of doing business and how we want to do things. So, along those themes of the organization and operations and administration, one of the things I wanted to, the chairman mentioned a little bit about running things like a business, and so one of those topics is something I've heard from people within the Department of, or I guess the Commission of Health or the health departments, is regarding merit and non-merit employees. And I know that I think some of our, I think they're the service region administrators, I believe, are merit employees.
Yes.
So I'm going to have a multi-part question to make it one. So the first part is if you could comment on that issue, because I think there's some discussion that the merit system is an antiquated system in our state, and it can be in the way of a lot of things. I know the purpose of it is to protect people from political ramifications of things and change in government. But first of all, if you guys could comment on that. Secondly, on the organization. Obviously, we rank really poorly on child abuse. And I know DCBS, the work that you guys do as a pediatrician, I used to call when there was issues. There was always someone there who would handle issues. I know the meetings that go on now to review deaths of children and some very graphic things that most of us couldn't imagine. I know I've heard cases of, and I've got a vivid imagination, things I couldn't make up of things that happened to children and in people's lives. When you talk about that debriefing, how important that is, just as a doc, when I've done things, is people hear things, you maintain a professional demeanor, and when you leave that, the emotion that overwhelms people is, if you've never been through it, you can't understand it, because you have to manage your own. When you hear that, the shock of that has to be expressed at some point in those people's lives. So I appreciate the gravity of some of that work when you say that, Commissioner, of what they have to do, but because we rank so poorly on child, safety issues nationally, and it's a big focus, and we have talked about dividing things up. I know neighboring states will have. I know I've looked at Tennessee. They have things like they have a commissioner of health, which is actually a cabinet position. They have one for child services, and then one for human services as well. And so I would like to get your thoughts on what you think about if we did isolate, let's say this as just an individual structure to focus on improving our child situation. Would that be of benefit? Would that not be of benefit? I'm thinking out loud. I'd like to get your opinions on that, and then on the merit employee situation as well.
So I'll take the first stab at both of those. I've been a merit employee in the system, and have there were greater benefits a long time ago, right? With retirement, with regular raises, those kinds of things. We haven't had that in a long time. So I think part of what we need to balance with what we see in terms of the personnel system and the merit system is there have been, again, it goes across a bunch of administrations and a bunch of different general assemblies and a bunch of different parties in control. So I mean, it goes across a lot of things. And with a big organization comes unique challenges. There's no question about that. But so that's kind of the first part. I'm not sure I answered much other than I think there are challenges to any system that we may have. The second is I lived through the splitting of the cabinet, health services that described John Morris and Secretary Morris and Secretary Miller. The problems that I see with that, if you're trying to bring like all your systems to bear, what happened when we split was it was almost like a shotgun wedding, or this was a shotgun divorce. And so what happened was, folks, we struggle with silos, right? We struggle because we want to work on problems inside individual departments. One of the things I challenge everybody to do, frankly, is work across systems, or else you're never going to have the impact that you want. And different folks have taken different view of that. Some have set up more competitive nature within the departments. I think my style is more collaborative, and my fear in splitting things off. One, there's a financial cost because of how we do the arcane thing of cost allocation, which you'd increase your administrative costs, and that's what you couldn't recover probably through federal grants. And two is I'm not sure it's any more effective. I'm not. But again, I'm biased, and I will admit that bias. I'm biased because what I've seen in other states is you have, for instance, a Medicaid commissioner that doesn't want to work with a sister agency because, to that sister agency, they need another $1 million, which to Medicaid is usually nothing. But the Medicaid, they're always begging at my door. I heard people saying that, right? And it's a challenge. It's a challenge to have folks think about what's the impact of a program that funds throughout different systems. So I'm meandering around, and I'm getting us up to 5 o'clock, and I apologize. But I think it works better together. I think within Kentucky, particularly, what we define as abuse and neglect, particularly the neglect piece, I wish Senator Adams were still here, around some of that's just poverty. And how do we distinguish what's poverty and what's not? I think it inflates our numbers some. I really do. But
Yeah.
it's it's like I always say that kind of thing is like complaining about the refs in a ball game. It's somebody's going to be first and somebody's going to be last. And what we really need to focus on is reducing child abuse and neglect.
Absolutely, and I appreciate all that. And like I said, I know there's states like Massachusetts which have less. They have less cabinet members, while others have more. And they all have different rankings, and everybody's got a different way of structuring. And I just wanted to get that feedback.
Sure.
From the merit employee position in this cabinet, probably more so than others. When we discuss health and welfare issues, typically there's not a lot of partisanship in this stuff, in this space. And I think we all agree it's just trying to find, sometimes it's where we spend monies and that kind of thing, but there isn't a lot of political bickering, or at least I've taken some pride in trying to keep that out of a lot of our committee meetings. It happens anyway, but because of that, it also, there's value in the people that serve within the cabinet. And many of you have served across multiple administrations, right? People of different political parties. Why are you still there? Because you bring value, you bring experience, you know what you're doing in that space, and that's valued, particularly in this cabinet, more than perhaps others. And so that's why I often wonder if the merit system, at least in this cabinet, gets in the way, and there's value in people that want to be. So I'm not sure that a lot of folks come in and say, hey, we're going to remove people from political reasons, because there's value of the people that serve in those roles. And so that's why I'm wondering is, I hear from folks that are working within different parts of it saying, this is an issue, this gets in the way. Things don't change because these folks don't have a reason to. I've heard that from a lot of different folks. I'm wondering, do we start to clean that up, at least, even if it's not system-wide, at least within this cabinet, to say, we're going to remove that, knowing that it's a bit of a different animal than the other cabinets that are out there, because there's value in human experience in the people that work there, no matter who the governor is or whoever the new political party is that comes into play, that they say, hey, this person's really good at what they do, and hey, just keep doing what you're doing. We've heard that a lot as there's changes in it. So that's why I wanted to offer that angle, and just think about it, give us your opinion, because we've got time to start discussing that. But it was something I wanted to bring up today just to see your thoughts on it. And thank you, Mr. Chairman. I appreciate it.
Thank you. Just a reminder that we only have 3 meetings left, September, November. Next one will be September 21st, 2022. I think we've all kind of reached a conclusion that our work will not be completed in one session. We'll take 2 or 3 sessions, but we're hoping that maybe we can have something prepared for in this next legislative session. But to that end, again, how positive those things that came here today thinking that they were going to testify. We're truly not in a position to take testimony from anybody other than those we've invited here. I can't tell you the number of people who approached me and said, I'd like to talk about this or I'd like to talk about that, even employees. And there's just no effective way we can do that. As Senator Alvarado said, we're not a committee, we're a task force here to gather information and try to decipher what's happening. So my apologies if there's some expectation that folks thought they were going to be able to speak today. We're just not in a position to do that. And if you can see this organizational chart, you'd see if everybody wanted to talk about each one of these, we'd be here until the 12th of never. So Again, my apologies if there's a misunderstanding. With that, there's no other business. We will stand adjourned for this meeting and see you in September. Thank you.
Thank you.